Hey tribe, welcome back. In today's video, we're going to be breaking down acute stress disorder versus post-traumatic stress disorder, so stay tuned. And before we jump into that, this upcoming Saturday, November 12th at 2 p.m. Eastern Standard Time, we're doing another paid study group. Check the link in the description for the details and everything, and this one's going to be on program evaluation. Now let's jump into the video. So with post-traumatic stress disorder or PTSD, and it's actually, I put the page number right here of 271 in the DSM-5, just in case you guys want to give it an overview as well. PTSD is when someone goes through something, sees something, or learns about something related to death, a serious injury, a serious threat, or sexual violence. And a quick note, the criteria for PTSD is slightly different for children under 6 years old, but that information is virtually the same. The exam will most likely want you to recognize the PTSD symptoms being displayed / talked about by the client, so within the question itself. So this information that we're going to go over here, it's more so what you need, right? We want to look for those highlighting factors that stick out so we can identify it, right? The exam isn't going to, give you the slightest bit of details where it's like just one margin off and like the answer's wrong and everything. Is usually going to be pretty clear to help you identify it. And for children, trauma reenactment may show up in their play. And a tip for understanding the diagnosis, read the diagnosis backwards. This method can be applied to all diagnoses, and I'm going to show you exactly what we mean with that. So reading the disorder backwards tells you what the issue relates to. Disorder means that there's an issue with something. When something is in order, it's working just fine. When something is not in order, it's in disorder, meaning there's an issue with something. The words before disorder tells you what the issue relates to. And I'm going to show you exactly what we mean in this example. And I even color coded it a bit to help us. So post equals afterwards. Think of when someone says post interview. So after the interview, meaning afterwards. It's the opposite of pre. Think of a movie that's a prequel to another movie, meaning before. So there's the prequel, and then post is again afterwards. So like post interview. Traumatic equals emotionally distressing. It's a traumatic event. So it was emotionally distressing, whatever that situation is. So when we read it backwards, you see the two reds right here. Disorder. Disorder means there's an issue with something. There's an issue. The yellow is stress, right? Related to their stress, and the green is post-traumatic after an emotionally distressing event. So even if we had absolutely no clue what PTSD was, what it meant, this is breaking it down right here. There's an issue because it's a disorder related to their stress, that person. There's an issue related to their stress after an emotionally distressing event. So pretty much, how they're responding to this issue that happened, like this traumatic event. Now ask yourself, what does this look like? What does a person that has an issue related to their stress after an emotionally distressing event, what does that look like? And again, we can use this for all disorders. So this is what it looks like. Someone reliving or being reminded of the traumatic event due to flashbacks, intrusive memories. So like those memories just kind of like popping up in their mind. Nightmares, avoiding places and people. So isolating, memory loss, negative outlook on people / the world, being in the triggering environment or something that reminds them about the traumatic event. Startle response, so that hypervigilance, meaning like, you jump when they hear a loud sound, looking around, being on edge or eggshells, because the person is trying to be aware of any danger or threat that may pop up. So on these exams, whatever exam we're taking, it's not so much as about just knowing the specific definition of these things. Sometimes we could get a definition related question, right? But it's more so when it comes to these diagnoses, like, what does that look like? What does bipolar look like? Someone experiencing the symptoms of bipolar look like? What does someone experiencing the symptoms of, generalized anxiety looks like? What does someone experiencing the symptoms of PTSD look like? And what we can do is the answer choices. Let's say answer choice A is PTSD, B is agoraphobia, C is generalized anxiety disorder, and D is schizophrenia, right? And we're like, oh man, based off this question, a significant event happened, but we don't know, which one of these answer choices it is. Reading it backwards, again, was like, wait a second. When we read it backwards, there's an issue in this particular area. And then that can help us identify, like, wait a second, if there's an issue in this particular area, like the source of the issue, again, with PTSD, the source of the issue is related to their stress after an emotionally distressing event. So if we're reading a question, we're like, wait a second, this person experienced an emotionally distressing event X amount of time ago. So they must, and they're struggling with it because they're giving off symptoms of the flashbacks, nightmares, whatever it may be. So it must be PTSD. So that's how we want to kind of approach it. And when we scroll back down, someone with PTSD could also experience dissociative symptoms such as depersonalization. Depersonalization is you feel detached from your mental and or body, as if you were observing yourself from the outside in third person. It could feel like you are in a dream or moving slowly. D meaning no longer. So you depersonalize something. Think of when someone says to defund something, no longer fund. With this, it's no longer personal because, again, it's depersonalization. With this, it's no longer personal. Hence, the person is having an out-of-body experience. They're detached. If someone is detached, it's no longer personal, right? So these are just some of the wording that can help us where, we're really breaking it down where it's like, wait a second, D meaning no longer, personal, right? So it's no longer personal, but it all relates to ourselves. Because if the person or the client is experiencing depersonalization, it's no longer personal to themselves. That's why they have that out-of-body experience, that third person, right? Or they can experience something called derealization. The person feels like the world around them is unreal, dreamlike, distant, or distorted. So again, D meaning no longer. And then realization, we could just look at it as real, no longer real, no longer real. If someone is feeling like, hey, it's no longer real, the person feels like the world around them is unreal, dreamlike, distant, or distorted. So they're really kind of just removed from themselves, from the situation. So these are two things that someone with PTSD could be experiencing. And the time frame, symptoms last for at least 1 month, so 30 days plus. So after the traumatic event, whatever that event may have been, the symptoms have to be present for at least 1 month to be diagnosed with PTSD. If it's been a week, if it's been 2 weeks, 3 weeks, not yet. It really could be PTSD, but not yet. Once it hits that 30-day plus marker, it is now met the criteria to be diagnosed with PTSD. Yes, they could be having the symptoms, but the time frame is here for a reason because it is made the marker. It's of a certain significance. Think about schizophreniform, where before it can be schizophrenia, which is 6 months plus, it has to go through that phase first, because if it reaches 6 months plus, it's like, oh yeah, that's absolutely schizophrenia because of how significant, how long the symptoms have been lasting for. But before that, it's schizophreniform. Now we go to acute stress disorder. F43.0, this is on page 280 in the DSM-5. Acute means short-term / brief but severe. Think of an acute level of care such as inpatient hospitalization. This is the PTSD before the actual PTSD. The time frame, you have symptoms of PTSD for less than a month. Technically in the DSM, it says 3 days to 30 days. But again, the exam's not going to say, oh, it's only been 2 days type of thing, and they want you to identify that it's acute stress disorder. They're not going to do that. But essentially, if someone experienced a traumatic event and it's under 30 days, you want to go with acute stress disorder. Once it goes past the 30 days, and I know some people may say like, wait, Ray, how about if it's like a leap year or it's like 30 days, 31 days? Again, the exam's not going to nitpick you in that regard. The time frames are usually going to be pretty clear. Like they're going to say something like 2 months or longer type of thing, right? They're not going to nitpick you in that regard. But once it goes past that 30 days, and the symptoms are still present, they're continuing, then it's now PTSD. Just like how schizophreniform, once it hits like that right before 6 month marker, once it goes to 6 months plus, it's now schizophrenia because of how long the symptoms have been present for. And the symptoms are essentially the same, right? The symptoms, if you're trying to differentiate between acute stress disorder and PTSD, you're going to have a very challenging time because they're essentially the same. For these ones, you want to pay attention to the time frame. And an easy way to remember this again is acute stress disorder is the PTSD before PTSD, right? 3 to 30 days, same symptoms, criteria, everything, acute stress disorder. Once it goes past those 30 days, now we're entering the realm of now it's officially PTSD. And when we go down again, what is the best intervention for PTSD? According to the Mayo Clinic, cognitive behavioral therapy or CBT, exposure therapy, so eye movement desensitization, and reprocessing or EMDR are appropriate interventions for PTSD. What is the best medications for PTSD? There are many different medications that can be used to treat symptoms of PTSD. According to the Mayo Clinic, the medications listed below are approved by the Food and Drug Administration, or FDA, for PTSD treatment. And those are usually depressive disorders / antidepressants are in a class of drugs known as SSRIs. Yes, there can be anxiety meds and everything like that, but these were the main ones highlighted to pay attention to. So Zoloft or sertraline, that's the generic name for it, also used to treat premenstrual dysphoric disorder or PMDD, panic disorder, and a social anxiety disorder. But Zoloft and sertraline and Paxil or paroxetine, those are the main medications that we want to pay attention for of if we get a question like, hey, the person experiencing symptoms of PTSD, what medication are they most likely taking or most likely to be prescribed? We want to go with these 4 right here. And again, it's the same medication, but this is just the generic names for them right here. And as far as what is the best intervention for PTSD, usually CBT, an exposure therapy, or EMDR. And the exam, again, is not going to say, A, CBT, B, exposure therapy, 3. And so again, it's not going to do that to us. They're usually going to be very different in that regard to help us identify what is the preferred option of the answer choices. And I'm also going to put the link down to the Mayo Clinic as a reference source for anyone that wants to dive a bit more into it, and also put the medication video that I created to help us memorize about 13 medications with seemingly no work by memorizing 2 acronyms. Okay, tribe, that's it for today's video. Thank you for watching. As always, don't forget to tell a social work friend because we don't want to be licensed by ourselves. This upcoming Saturday, November 12th at 2 p.m. Eastern Standard Time, we're doing another paid study group. This one is going to be on program evaluation. So if you'd like to attend, click the link in the description to fill out the form and get all the details and all that great stuff. And yeah, don't forget to like, comment, and subscribe, and I'll see you guys next video.